Okay, hello everyone, and welcome again to another wonderful webinar here with my partner, Ferti International. You know, it's going to be actually a year soon that I met Esther, and I had the amazing honor to become a part of your team. And today we are with Dr. Maria Arque. And what we are going to talk about today is about all the benefits of egg donation in Spain and the process there. So again, welcome, Dr. Maria. It's a pleasure to have you again. It's a pleasure for me to be here with you. This is our second time. Looking forward to have more of these webinars. And let's just jump into this subject, especially, you know, now in these times of, you know, a little bit of confusion and all of that, a lot of IVF cycles that were canceled when all of this started. But now that slowly the world is starting, you know, to go back a little bit to what it was normal. So, you know, I have seen a lot of people starting again their process to become parents. So as we were mentioning, we're going to talk about egg donation in Spain and all the procedures and how it works, how you can do, how you can apply. So let's start with some questions to you, doctor, before jumping into the emotional side. And is, Ferti offer this service, but a lot of patients, a lot of people, you know, that maybe go through IVF and then they fail with their own eggs or their own sperm, or there is sometimes solo women that look for being just mother through egg donor. So then they are in this situation where now, okay, my option is egg donation. What kind of patients would benefit from that egg donation specifically?
Yeah, so thank you, Monica, for the kind introduction. As Monica said, I'm Maria, Dr. Arque. Nice to be here with you all. So basically, patients that would be benefiting from egg donation are all those patients who already have tried several attempts of IVF with their own eggs that did not work, patients that unfortunately have what we call premature ovarian failure because of some kind of genetic condition or because of the fact that they have had to go through a treatment like chemo, radiotherapy because they had a cancer or because of other reasons. Also for all those patients that have had to have their ovaries removed for whatever reason, and also for basically patients that have genetic conditions that we cannot test for with PGT, or that are conditions that even though we would test embryos with PGT, we cannot somehow have embryos that are healthy. So those would be the main indications for undergoing a treatment with the eggs of an egg donor. Yeah, that could be it, I think.
Okay, so now knowing that part, you know, and you know, people usually that when they get into this path, there is a lot of options in their countries, but today, you know, there is also the option of going abroad, and there is actually been, you know, kind of proven that sometimes, a lot of times, going abroad is actually a little bit more, less financial impact. So let's talk about Ferti and Spain. Can you explain about the Spanish legislation regarding egg donation? What information will a person, will egg donor will get from it?
So basically, anyone, the most important things regarding Spanish legislation and egg donation, especially for patients who are in America, because that works in a very different way, is that egg donation and sperm donation in Spain are anonymous, which means that the person who's going to receive the eggs or the sperm cannot know anything about the identity of that person, and neither the donor can know their identity. Second important thing is that egg donation and sperm donation are altruistic in Spain, which means that donors will just get a very small economical compensation for undergoing the cycle. So just to cover all the expenses regarding all this, they have to come to the clinic to test and all those things, but it's not something lucrative. And then the third important thing is that under Spanish legislation, the person who's going to receive the eggs cannot participate actively in the selection process of the donor. It is the duty of the clinic to select an egg donor or a sperm donor that looks as much as possible to the person who's going to receive the eggs. And what are the characteristics that we're looking at? We're looking at the ethnicity, at the color of eyes, color of skin, color of hair, height, weight, complexity, blood group, all those things. So I always try to explain that as if we were trying to look for the 25-year-old twin sister that we never had, to be like a egg donor, right? So someone that looks as much as you as possible when you were in your 20s or when you were 25. So that's the idea. And the information that someone would get from the donor is this general information. So the age, the blood group, and a little bit of background of general physical characteristics. That's all the information that we can get. I also want to clarify, because I get this question from lots of patients, especially from the US. Lots of times we don't have information about the educational background, even though we do psychological tests and tests to make sure that they are, that I will go through this a little bit later. And a lot of other times we don't have also information about the hobbies of the donors.
Oh yes, here is.
I think for how things work in the US, this is something that lots of patients require or ask for, because in the US I know that the hobbies and the academical background of the donor are informations that usually patients get and that are very important for them. So just to make sure that not always, there's sometimes that we can get this information, but not always.
So it's very good that you clarify that, because yes, as I know, here in the States, that process is a little bit more, into the detail, which, is up. That's why I said it's up to the person that where she or him decide, or the couple decide to do the egg donor cycle. And I think that that's one of the things that specifically thing that you just mentioned, of the detail, specific things here. That's one of the things that also egg donor patients, potential egg donor patients, are kind of getting too much information here. They just, need to know that it's a healthy, have that characteristics, genetic characteristics that they have, and they'd rather go abroad because the law, the legislation is completely different. What tests are donor eggs get, in the clinic? Because, what are the tests that, of course, you will give to the patients that are going through the egg donor option to build a family?
Yeah, okay, so here I will explain first all the selection process that we do for anyone who wants to become a donor, and then I will explain the test that someone who wants to do egg donation needs to do.
Yes.
So basically, from all the women that want to become egg donors, not all of them are eligible to become egg donors, and there are several tests that we need to do. So first of all, we do a very detailed medical history of themselves and the family to make sure that there are no medical contraindications, neither in the family, neither themselves, to do the egg donation. So no one with genetic problems in the family could undergo a treatment like this and become an egg donor. The other important thing that we're going to, once we've done this and all this is clear, we're going to do genetic tests. We're going to do tests for infectious diseases. We're going to do psychological tests and general gynecological tests and general health blood tests. So from the perspective of psychological tests, is a general psychological test to make sure that they don't have any disease or any disorder that might contradict doing the donation and make sure that they are mentally healthy. Then we do tests to make sure that they have a good ovarian reserve, normal uterus, that they don't have any infectious disease like HIV, hepatitis B, C, syphilis. And nowadays we're also doing tests of COVID for all donors before they donate. And then from the genetic perspective, we do two different kinds of tests, okay? One of the tests that we do is called karyotype, and the karyotype is kind of like our map of chromosomes. All human beings, we have a map of chromosomes. Women, we have 23 pairs of chromosomes, and in the pair of sexual chromosomes, there is one X and another X, so two X's. And in the case of male, they have one X and one Y. Sometimes we might be carriers of small changes in the karyotype that even though they're not affecting ourselves, if we were about to have a child with someone who carries a small alteration in the chromosomes, that would mean that we would have higher chances of having a problem afterwards or having a baby with not a chromosomical alteration. So therefore, we do not accept donors, or we do not accept as a donor someone who has any alteration on the karyotype. And the other genetic test that we do is something called genetic carrier screening. The genetic carrier screening is to check for the information that we have inside the genes. Okay, it's not about the karyotypes. And the chromosomes. It's about the information that is inside the genes. All human beings, so both you, Monica, myself, the donors, the patients, everyone, okay? Everyone, we all carry some genetic diseases that even though they are not affecting ourselves, if we were about to have a child with someone who is a carrier of the same disease that we carry, but it's not affecting us, we would have 25% chances of having a child affected, okay? I'm speaking about diseases like cystic fibrosis, thalassemia, things like this. So one of the things that we do is do that genetic carrier screening for the donors. Oh, the donors must be negative for any disease that it's linked to the X chromosome, because otherwise we cannot accept them, okay? Because if it's a disease that it's linked to the X chromosome, it's very likely that the children will get it. But for all the other autosomic recessive diseases, what we can do something that it's called genetic matching. What does that mean? That means that if we have a donor that is a carrier of one genetic disease, the couple who are going to receive the eggs of that donor, we can test the husband, the male partner, the one that we will be using the sperm. Yes. And that way, we not only look for an egg donor that looks as much as her as possible in the sense of physical characteristics, but also for a donor who's not a carrier of the same diseases that he carries, to minimize or reduce as much as possible the risk of having a child affected with one of those diseases. Having said that, this test has some limitations, obviously. Why? Because first of all, we cannot test for all the diseases that exist in the world. There are some genetic diseases that we don't have tests for. There's also something called de novo mutations that exist as well, and it's something that we cannot predict, okay? So, but it is a test that helps us to detect or to prevent diseases that potentially would be very severe and that usually would be diagnosed during childhood. Okay. Oh, wow. And once we've done, that's not mandatory to be done for patients, but we always screen all donors. Oh, okay. Right? So that's something optional to do that genetic matching. And I think that regarding the donor, I have already explained everything, all the tests that we do. So those are all
receiver of the egg donor, right?
Yes. Now let's speak about the person who's going to receive the eggs. So the person who's going to receive the eggs will have to do general fertility test to make sure that she doesn't have any medical contraindication to become pregnant. Okay, so we're going to have to do also blood tests to make sure that she doesn't have any infectious disease like HIV, hepatitis B, C, syphilis, all those things under European legislation must be done. Nowadays, we're also doing the test for COVID. We will also do a transvaginal scan to check that the uterus is fine and that there are no problems. We're going to do a pap smear test to make sure that the cervix is fine. We're going to do a test for rubella to make sure that the person is vaccinated and immune and there is no risk of rubella infection during the pregnancy. We will check the thyroid. We will do a general full blood count to make sure that there's no anemia or anything like this. And that's pretty much it, okay?
And we will,
we will check also the blood group to match it with the donor, okay? Because the way the blood group of the donor is going to be or the same as the recipient or the partner, or a possible combination of both blood groups.
Okay, and then also the partner of the person that is going to be the receiver needs some tests.
Yes. So, yeah, the thing that he will need to do is also the vitals, the same, the infectious diseases tests. He will have to do semen analysis. Okay. And usually we also ask him to do the karyotype, which is that genetic test that I explained that we ask the donors to do the one for the chromosomes. And then if the couple decides to do that genetic matching with the donor, he also is going to do the genetic the genetic test.
The genetic
carrier screening, and then we can match the info of the donor and the partner.
Wow, it's incredible how, you know, I think about it and I go back when I was, when I started my IVF. It was 15 years ago. And I'm sure there was, you know, egg donation and all of that. But as we, you know, as days pass, the advance in technology, you know, in ART technologies is incredible. You know, there is a lot of tests that I didn't even have idea, you know, like they didn't exist when I was. And, you know, I said to myself, well, I was lucky, you know, my kids, my 2 girls came, you know, like normal, and, you know, there is no issues until now. And today, you know, one of the beautiful things that I will say ART technologies offer is all that what you just mentioned, you know, tests for almost everything, not everything as you said, but almost everything, to kind of give a peace of mind for any couple, women that goes through this process, that, you know, to assure them that eventually they're gonna have a healthy baby in their arms. I'm gonna jump into my next question, because actually my next question was about the recipient and the partner, but you already mentioned all the tests. Can you explain us the timeline and organization of the treatment? How many times will a person have to travel to Spain to do that? You know, because we are most like promoting the overbroad treatments. So.
Absolutely. So basically, usually the first step would be to do an online consultation with me or any of the other consultants of the clinic to just assess the situation, explain you a little bit how the treatment would work, and request you to do all the necessary fertility tests to be done. Then usually what we do to organize everything in the simplest way possible, what we would recommend is that the partner, in the case that we're doing that with a male partner, the male partner comes to Barcelona, we freeze the sperm, we do also a genetic test, and he can go back, okay? That way, what we're going to do is that the donor is going to undergo the stimulation. Once the donor is ready for doing the egg collection, we're going to take the eggs out from the ovaries. We're going to put them together with the sperm sample that we've got frozen. And then we're going to let the embryos develop in the lab until they reach the stage of blastocyst, or day 5, which is the same thing. Once we have the embryos at the stage of blastocyst, we're going to freeze them. And once we have that certainty that we have good quality embryos at that stage, the woman who's going to receive the eggs, once she gets the period, she's going to start the endometrial preparation. Usually around 10 days after she started the endometrial preparation, she will do a scan. We're going to check out what is the result of the scan. And then if everything is well, then she will start progesterone, and 5 days after we will be doing the embryo transfer, which means that in total, couples generally have to come 2 times. First time just the male who has to come to leave the sperm sample, and the second time would be only the recipient who has to come for the embryo transfer. And each time they have to stay only for 1 day. Obviously, for someone who's coming from the US, and especially for the day of the transfer, I recommend to come at least the day before, just to avoid any unnecessary stress on the same day of the transfer, because the transfer is a day which is very emotional, very special, very sensitive, and to avoid any problems. There is another way to organize that, which is synchronizing the cycle of the egg donor with the person who's going to receive the eggs. And if we synchronize that, that means that when on the day that the egg donor is going to be ready for the egg collection, a little bit before, the couple has to be already in Barcelona. The endometrium already has to be prepared. Yes. For the woman, and then on the same day of the egg collection of the donor, the sperm sample will have to be left, and then 5 days after, the embryo transfer will take place, and then the couple can go back home, which means that generally speaking, they would have to stay in Barcelona for around 1 week, more or less. Okay,
so and I'm sorry to interrupt. So from the 2-week wait after the transfer, they just need to stay 1 week in Barcelona?
They would have to stay in Barcelona, not the week after the transfer, the week before, because as we need him to leave us the sperm sample, and it's going to be fresh sperm sample, he will have to be there on the day of the egg collection of the donor. And from that day that we do the egg collection, it will take 5 days more to create the embryos and have the transfer. So the minimum amount of time that we need them to be here, it's at least a couple of days before the egg collection of the donor to make sure that the COVID test is negative, that the endometrium of the recipient is prepared and everything is fine. And that way they would not do 2 trips, but only 1.
And a question too, because it might come from, you know, our audience. Once the transfer is done, do they need to stay?
No, they can go home.
They can go, and then the beta test is going to be performed here.
Yes.
Okay. Yes, because you know, I know that there's people, yes, that we want maybe the beta test there. So it's up. I guess it's up to them.
Absolutely, yeah. If they want, they can stay. I'm explaining it in the way that they should or have to stay here the minimum amount of time. Obviously, I have patients who say, you know what, Maria, it's much cheaper and much convenient to stay for the whole treatment in Barcelona because I can work remotely, and having only a scan in the US, it's much more expensive. So I'd rather do everything in Spain. Okay. And
yes, that's what I wanted to touch that point.
Yeah, exactly. I have patients that's what they decide, and they stay here for the whole process. So that's also an option. But I'm explaining always the way to minimize the amount of time to be in Barcelona, because a lot of people need to organize,
of course.
With work and with other commitments, and make sure that they can just work their lives around the treatment as well, which is not that easy sometimes.
That is so true. So Dr. Maria, now, what are the success rates? Why, you know, this question is so important because, you know, one of the things I usually recommend my clients that come, you know, looking into that is you need to check the success rates. And one of the things I love about Ferti is that you guys always guarantee like the baby in the arms. So in this, how and what are the success rates?
Yeah, so I agree with you, Monica. It can be very tricky sometimes to get that information because sometimes it's very misleading. At the end of the day, for everyone who's doing a fertility treatment, as a patient or for me as a doctor, I don't really care about a positive pregnancy test. Don't get me wrong. Obviously, I'm happy about having a positive pregnancy test, but the thing that I care the most about is how many healthy babies and healthy moms do we have at the end of the day, which is the goal. That's we're there. So basically, we have different egg donation programs with different guarantees. The basic standard treatment would be a treatment in which we can guarantee a minimum of 8 mature eggs, and with this treatment, if there are no problems with the sperm, we guarantee a minimum of 2 embryos. I am a very strong believer and very strong defender of single embryo transfer, because we know that twin pregnancies are much more risky than singleton pregnancies, and there's growing data about that. And as I was saying before, we want healthy babies and healthy families, and full-term pregnancies will have complications, and that's the reason why I insist a lot about transferring only 1 embryo at a time. Having said that, every time that we transfer 1 good quality blastocyst after the egg donation cycle, pregnancy rates are around 50-60% per transfer, every time that we transfer 1 embryo. But you have to think that the minimum amount of embryos guaranteed is 2, and most times we end up freezing between 3 or 4 embryos per cycle, which means that if we look at the cumulative pregnancy rate, which is after we have transferred all the embryos that we got out of 1 egg donation cycle, our pregnancy rate is around 80-85%. It's very good. Okay,
it's a very good one.
And yes, as you mentioned before, we also have a baby guarantee program, which is a special program that you have to fulfill some specific criteria to be eligible for it, but in which you would be paying for 3 egg donation cycles, and that would be included in that kind of warranty. And if you don't achieve a healthy baby born, then all that money is refunded.
Oh, wow. Yes, I love that program that you guys have. It's incredible. When Esther was here, she left me all the information. And as you said, definitely the positives is, again, like you say, congratulations, but positives, it's something that doesn't warranty that, you know, like I always tell my clients, please, doesn't matter how big is the clinic, how many positives they got. What you need to look into it is how many babies that women, that couples have in the end of the pregnancy, you know, crying in their arms, like, you know, that joy is fulfilled, because that's the ultimate goal of these medical treatments. So basically, this is what I wanted to ask you. I don't know if you want anything to add, because, you know, you are the doctor. I was, you know, I when I was in school, I used to love bio. And one of my favorite parts was that table in genetics, you know, to find out when a baby or when one of the kids is gonna be having the possibilities of having certain things. It's so beautiful to understand that. One thing I wanted to add, but you said something, hold on, and I have put notes here, is what it was about. Yes, I think about the success rates.
Mm-hmm.
When you mentioned, so there is a possibility of the couple to stay the whole treatment in Spain or to come back here. So there was a, yeah, I remember there was a question of one of the registrants in the webinar. You guys don't have a surrogacy? No.
No, surrogacy, it's not legal in Spain. We cannot do surrogacy.
Oh, really? Yes, because someone asked me for that, you know, like, and I was telling her, I'm not sure. I think they don't have that.
No, I think that in Europe they have to go to Cyprus, and there are some other countries. I'm not certain. I think
Ukraine.
Ukraine as well. Ukraine and Cyprus, I think, that are the main European countries that also have surrogacy, also like US, but not in Spain. It's not legal. It's not possible.
Okay, so that was one of the questions. And as you mentioned, another thing I wanted to add, with the technology today, with all the advance in medicine, I think that it's really, like you said, a transfer of one embryo. I have seen it. They have successful rates, because you see, years ago, when I was like 15 years ago, it was different. You know, less PGT testing, less advanced. So there was, you know, like I transfer more embryos than that, but still, women, when we reach after 35, we increase our risk of multiple pregnancies. So like you said, a healthy baby is so important. And today, when I have seen all of this advance, I also root for that one, maximum two embryos, because yes, it can be like a multiple pregnancy. So I don't know, doctor, if you want anything to add.
Yeah. I mean, I don't really think that I think that generally speaking, we've covered all the most important things regarding how egg donation works in Spain. Obviously, if after the webinar there are some queries, anyone has any questions, I will be more than pleased to address them all. So Monica, you can forward all those questions to me, as you know.
Yes.
I'm happy to answer anything. I think that we've covered it all, because we spoke about the timeline, the legislation, we spoke about the tests, we spoke about success rates, we spoke about that we usually recommend to transfer only one embryo, we spoke about all those possibilities, the genetic matching. So I think that we've covered it all. I wanted to ask you a few questions as well, Monica, if that's okay.
Yes, absolutely, yes.
Yeah, so my first question would be, which is the advice that you could give to anyone that has decided to go through egg donor to reach parenthood? What would you advise them to do?
Okay, so you know, one of the things that I always say to anyone that choose that path, the first thing is that I know to get into decide that path, it's difficult. It's difficult because, you know, as humans, as you know, I get that as our intuition, and the fact that we're born with that kind of, let's call it, right of become parents naturally. So, and after, you know, doing so many things, not becoming pregnant, going through IVF, and then see that there is other possibilities, but it's not the possibility of being parenting a child that is from one of the two. So once they have decided to do that, I know that it had become like a path that they have to walk that it was already difficult. So my best advice is to find the same support that any other couple or individual is finding through when they're going through IVF. Emotional support is very important, and I will say that for both parts, not only from the recipient, but I think that from the egg donor, because, you know, like, I think that in our mind, if I would be a egg donor, you know, I will want that my baby, you know, it's a baby, it's your genes, I will want to know that the clinic, if for example, like you guys, the person, not the recipient, not the donor, know the identity of each other, I will want to definitely be assured that the clinic that is doing this process assures me that, you know, they are dealing with people that really want to have kids, and these kids are going to be treated in the best way. So that emotional support for both sides, it's important. And I think that Ferti offers that with, you know, with me. I think with also, you have another two beautiful ladies that they are my friends, Stephanie from Fertile Self, and I think the other from the Stork and I, or something like that. Yes, for solo moms, which is incredible, because, you know, today a lot of women, they have built a career and they really don't feel the need to have a partner living with them, and they just want to be moms and go solo with that. So you guys offer all of that support, especially, you know, like solo moms. What is the other option? Well, I have my eggs and then a sperm donor, and sometimes even the eggs of the woman are not the best, so she needs to go both through donor. So I think that support is so important for both parts.
I couldn't agree more with you about that. Obviously, we have a psychologist in the clinic for the egg donors, and we do that psychological test that they explain. And the nurses that are taking care of all this program, they are very good at explaining everything at the very beginning. Obviously, the donors also have the opportunity to see the doctors, ask anything they want to know. So I think that from that side, this is all very covered. In Spain, it is not mandatory to have a counseling session before undergoing a treatment with egg donor or sperm donor. I used to work in UK and Ireland, and there it is mandatory to undergo a counseling session before undergoing a treatment with a donor. I honestly, probably my personal opinion is that maybe I don't really completely 100% agree about having to set that as something mandatory, but I definitely think that it is, I recommend it to all my patients, because basically you are, first of all, no one goes to a fertility clinic asking for an egg donation cycle. I mean, no one is dreaming about having kids with an egg donor. Everyone wants to have kids with their own,
yes.
at home if possible.
Yes.
But unfortunately, things don't happen always like this, and that's the reason why we exist and we are here to help. And a lot of times it's a process. It's a process that it's long. It's a process that involves a lot of emotions that have to be processed, have to be. It has to be managed properly.
Yes.
The fact of using the eggs of a donor or a sperm donor makes people have afterwards lots of questions,
yes.
doubts about how to address or how to cope with some specific things. And I think that even if it's only one session, to have someone who is objective, who is obviously professional and prepared to help you ask yourself the questions that you have to ask, to check if you are completely sure and you're completely aware about everything.
Yes.
I think that it's something that it's very useful and will help you to have a journey that it's going to be much more smooth.
And increase the possibilities of a positive and live pregnancy, because
Absolutely.
Emotions play a very important role in the end results of anything, especially in a fertility treatment. I actually have a very good friend. She's also a fertility coach, and she herself, her story is incredible. She had just a baby not long ago, and she had her other daughter, 2 girls. Both of them is egg donors from her. And the beauty of it is like her husband could do with his sperm, but he didn't. So he kind of, to, you know, I don't know, beautiful, like what he did, because he said, okay, so you go through egg donor, because of course her dream was with her eggs, but she couldn't. So she went through the process of acceptance, that is that. And then he says, so I do with a sperm donor too. And, you know, we both parent kids that they are from donor. It is so incredible story. And she is a coach that she also inspired that, because I know that it's difficult. You know, I try myself even to put myself in that place, and I go back and say, okay, what should I have done? So I would have walk that, and I would have find for support, because it's a very difficult decision in the end. But also, as it's difficult, it's also joyful, because in the end, you know, you carry a baby. You're gonna carry a baby, and somehow the genetics of yourself are connected to that baby, because you are the carrier, you know.
Mm-hmm. I completely agree. I completely agree. Yeah. So Monica, thanks for your time. It has been great. I don't know if there is anything else that you would like to add, or anything else that you would like to comment.
Well, no, Dr. Maria, I think that we, as you say, we cover everything. Basically, you know, if there is any questions to you or to me, they can comment below the video, or they can send us an email through the registration that we sent, and we will be more than happy to answer the questions. I know that what we are receiving is that they want more webinars with you, with Esther, with Arina. So I'm trying to work on subjects based on what the people is asking. And we will continue that. So, but for now, everything I think is clear. We cover your part and my part, which is the emotional support, which is really general, because it's the same like any other process. And basically that's it. And I really appreciate that you joined me today. It's always an honor to have your knowledge, you know, your opinion, your understanding, and the incredible caring and kind team from Ferti. Thank you so much.
Thank you. I just wanted to add one last thing about COVID, and that's it, just to update patients, because I know that obviously if it's not difficult enough to have to go abroad to do a fertility treatment, now with COVID, everything is a little bit more complicated. Obviously, we have a very strict protocol to avoid as much as possible any risk of COVID at the clinic. That's also the reason why patients will have to undergo a COVID test before they can undergo the embryo transfer or leave a sperm sample and all those things. And currently, the situation in Madrid, it's not very good, okay? But we are based in Barcelona, which is like more than 600 kilometers away. In Catalonia, which is the region where we are, and in Barcelona, the situation is pretty much controlled, and it's not the same as it is in Madrid. So for the moment, patients can still come and travel without any problem. If they need any kind of documentation from the clinic stating that they're coming for medical reasons, we can provide that to them. I also would like to send a message of responsibility for everyone to try to follow all the measurements that we have to follow to minimize as much as possible the risk of getting infected or infecting other people. And that's pretty much it. But for the moment, the situation here in Barcelona is controlled, and patients can continue coming. Okay.
Okay, thank you so much for that information, doctor. Because yes, you know, I also have heard that in few places in the world it's kind of going up, but then in others also is going down. So it's kind of balanced, you know. So, but it's very good to know that people kind of still know that they kind of still travel to Barcelona. Yes, I know Barcelona, all capitals in the world, kind of, you know, more people, so more risk. But it's good that you give us this information. Thank you so much.
Perfect, Monica. So a pleasure to see you, and I hope that we will have another webinar soon.
Yes, of course. Thank you so much. Have a good day to everybody.
Take care. Bye.